name is Dr. Hartman from Westwood-Mansfield Pediatrics, and anything discussed today is strictly for the patients of Westwood-Mansfield Pediatrics. And it's the opinions of the pediatricians here, and your pediatrician may have a different opinion than ours, and you should follow your pediatrician's suggestions. Today we're going to talk about the commonest infections in young children that's treated with antibiotics. Kids under 3, ear infections. Ear infections are common between the ages of 6 months and somewhere between 30 and 36 months, and usually generally go away and subside at that point. So there is always light at the end of the tunnel, although sometimes it doesn't feel that way when your child first starts having ear infections. I want to show you a little bit about the anatomy, but before that, what I'd like to say is give you a few little tips and things, because these are things over the years I've heard parents worry about. Number one, it is extremely unusual and extremely rare for ear infections, recurrent or persistent, to cause permanent hearing loss in a child. That is extremely rare. So therefore, if your child is in pain with an ear infection and Motrin or Tylenol helps in the middle of the night, there's absolutely no need to go to an emergency room if you're certain that this is an ear infection. So keep that in mind, that they, will not permanently lose their hearing from having ear infections. Secondly, 80% of ear infections resolve with no antibiotic, and if you use Motrin or Tylenol in a child over 6 months and they don't have a high fever or a moderate fever, i.e. 1/101, and they are not in pain, you give them Tylenol or Motrin for 48 hours, then you stop and see. And if that controlled the pain and there's no pain after that, you just sit tight and watch. If there's a pain while on the Motrin or Tylenol, then they need to be seen. Or if you stop the Motrin and Tylenol, they have trouble again, then you need to be seen by your doctor for treatment with an antibiotic. But remember, the Dutch studies have shown that 80% of ear infections will resolve on their own with no antibiotic. And again, I'm talking about kids between 6 months and 36 months with this. The other thing that you have to keep in mind is it's not an uncommon time between 6 and 12 months that parents bring their children into the office wondering if their kids have ear infections. And many times it's a developmental issue. In other words, when kids get their sense of what we call object permanence, in other words, if a ball rolls behind the couch, it still exists, so they go look for it. This is also oftentimes what kids do with nighttime awakenings. If your child's waking regularly at night at pretty predictable times, it's very unlikely to be pain from an ear infection, because ear infections in and of themselves cause pain randomly. And usually kids that are acting fine during the day and waking at night are less likely to have ear infections, because usually kids who have ear infections are irritable during the day as well as the night. Finally, there is a lot of controversy around speech and language development in children with ear infections. Years ago, it was thought that fluid in the ears could even affect the IQ. We found that that's not to be the case anymore. And in fact, most of the time when kids get tubes put in, it is often for quality of life issues for the child and the family and pain issues, rather than actually limitations in speech. However, when you go to an ear, nose, and throat doctor, they will check children's hearings before they decide things such as putting tubes in children's ears. Now, what causes ear infections? Well, nobody definitely knows, but we do know it's a disease of children often between 6 and 36 months. And let me just show you a little bit about the anatomy. Here is the ear, as we see it. And again, there's several rooms to the ear. This is the outer ear, the one with the hole here. This is the middle ear, right here. This is the area we're going to talk about right now about ear infections. If you notice, the eardrum is here. So water, parents sometimes say, well, is water in the ear from a tub bath or swimming cause, middle ear infections? No, it can cause swimmer's ears sometimes in the skin in the outer ear, but not a middle ear infection, because this is a sealed, waterproof wall, and nothing can get through that unless there's a tube put in the child's ear or there's a perforation. Now what happens is when an ear infection happens, pussy material builds up in this space right here. Here is the eardrum, here are the bones of the middle ear, and here is the eustachian tube that we always talk about that helps ventilate the middle ear. And this is what you see like when you're in an airplane and you got to pop your ears. This is what pops open and closes rapidly. So this is where all this builds up. Now, what could cause ear infections? Well, one theory is this eustachian tube is not quite functioning right. Either it's floppy or it angles down too much. And as kids get older, it angles up. So when it angles down, it obstructs here, causes negative pressure like a vacuum in here, pulls fluid in that then gets infected. That's one thought, all in here. And that's how an ear infection looks. Let's go over here for a minute. A bulging, raging ear infection looks like this, versus what a normal ear looks like is over here. Healthy, pearly, colored, what we call a good light reflex, and you can see all the anatomy, and it's not bulging, okay? So, coming back to this picture again, what we do see is the pus builds up back here and up here, and the eustachian tube can be one cause. The other thing is the immune system. You know, children's immune systems are just being developed, developing through this time period, and strengthening, being exposed to various things. So what happens is their immune system can't quite handle infections like ear infections yet. So when they get a cold, the eustachian tube gets inflamed, fluid builds up, pus builds up in here because it gets infected, and then an ear infection happens. And as I said, 80% of ear infections will resolve on their own without an antibiotic. And let's assume also, let me make one thing perfectly clear. These are in perfectly healthy children, not kids with immunity issues and things like that. The beauty of our vaccines, and I keep saying this again, is the most recent vaccines called the Hib and the Prevnar vaccines have reduced our ear infection rates by as much as 15, maybe even 20%. And that's been a wonderful bonus for hopefully helping to reduce, antibiotic-resistant bacteria that cause ear infections. Now, it's a fairly extensive discussion about ears, and sometimes doctors don't have time to go into this discussion. That's part of the reason we made this video. The other thing that I want to show you is this book. It's an old book that you can get on Amazon for as little as a penny, but it costs $3.99 or $4.99, whatever, to ship. It's called The Parent's Complete Guide to Ear Infections. It's still an excellent book. It's an older book, but it's still an excellent book about ear infections. It doesn't talk about watchful waiting 48 hours, and using pain medications, but it does talk in detail about the anatomy of the ear, possible causes, ear tubes if kids get to that point, and these are things that we are discussed in the book. Finally, one other thing is, second children seem to be more likely to get ear infections than the first. In our culture, kids are oftentimes 2.5 to 3 years apart. So as a result, when the second child is born, the first child may be going to preschool. And when they go to preschool, they can bring a cold home. And when the colds come home, and kids are over 6 months of age, the second child's over 6 months of age, this is the time they catch a cold, but they're more likely to go into an ear infection. By no means does this mean all kids who have colds that are babies get ear infections, but it is that they're more likely. And we think also, again, that has to do with the eustachian tube not functioning quite right. That's it today. I hope this has been helpful for you. Westwood-Mansfield Pediatrics, proactive in your child's care, empowering families for over 50 years. Thank you.